Introduction to Type 2 Diabetes mellitus. Type 2 diabetes is a progressive condition in which the body becomes resistant to the normal effect of insulin or gradually loses the capacity to produce enough insulin in the pancreas. Risk factor of diabetes type 2 is associated with modifiable lifestyle as well as genetic and family history. It is diagnosed when pancreas does not produce enough insulin does not work effectively, and when the cell of body does not respond to insulin effectively, known as insulin resistance. Next we are going to look on the role of vegetables in managing diabetes type 2. Vegetables contain bioactive compounds that typically associated with type 2 diabetes reduction or reversal include dietary fiber, starch resistance, carotenoids, vitamin C and E, flavonoids, magnesium and zinc. Dietary fiber help to keep blood sugar level in the body. It is divided into two, which is soluble fiber and insoluble fiber. For the soluble fiber, in diabetics patient it helped to slow down the absorption of glucose. For the insoluble fiber it also can give health benefits such as shortening the bowel transmit and soften the feces. Next is resistance starch. It is one of the starch that is resistant to enzyme and stomach acid. It contains few calories, so most of them does not cause raise in glucose level. As the bacteria in the bowel degrade the resistance starch, it produces new compounds that can give beneficial effects for diabetic patient. For diabetics, eating vegetables that contain both resistant starch and dietary fiber is crucial for reducing the need of insulin in starch digestion. Next is carotenoid. Alpha and beta-carotene, lycopene, lutein, zeaxanthin, and beta-cryptoxanthin are examples of carotenoid that have a protective effect against diabetes progression by relieving oxidative stress that interferes with cell absorption of glucose. Due to its antioxidant properties that overcompensate the endothelial dysfunction and glutathione level, vitamin C and E have been inversely associated with diabetes as it helped to normalize the blood glucose pressure in diabetic patients with hyperglycemia. Flavonoid also can give benefits to the diabetic patient as it helps to reduce the risk of type 2 diabetes. Magnesium is important, since it is required for insulin secretion and function. This assists in the control of blood sugar. Zinc is required for insulin production that regulates the level of blood sugar.